Welcome, welcome, welcome to all of you. It is great to see people from around the world having chosen in this busy, sizzling week to come here and be with us for the Fair Share for Health and Care. And we have advocates, activists, academics, UN agencies, government representatives, and everybody. So my name is Katja Iversen, and I am, in my day work, the CEO for the Museum for the United Nations UN Live, but I am also a passionate health and gender equality advocate and have been working on health and care for many years with the WHO, with Women in Global Health, with Women Deliver, with many. So it's such a pleasure to be here. But most of all, I am thrilled to be your moderator and instigator and maybe troublemaker and time police for this fantastic session where we will be releasing one of the best reports I have read for a long time. And if you haven't seen it, you can see the name here. And on your seat, there is in these environmentally sound days, there's a QR code so you can get the report. And then there is also the cheat sheet, if you just want the headlines to begin with, an appetizer to get into the whole thing. We will have a couple of different sessions now. We will start with the brains behind the report. I look very much forward to digging into that and them. Then we'll have a panel where we're discussing, what's the situation in country, in regions, and what can government agencies, organizations do. And then at the end, we will also get more into the what now action that we need to take. But I would be very pleased if I could be joined by, ta-da, the two brains behind the report. I have Michelle Isaac, economist and lead on gender equality, human rights and equity in the workforce department at WHO. And Jordan Shannon, CEO, United Health Futures and Institute for Global Health, University College London, but also Chief Medical Officers at STEMA. So thanks a lot for being here and for helping organize it. So let me start with you, Michelle. Now let me actually start with both of you. Just quick, fast, furious, and fabulous. What are the main findings in the report?
I'll start? Sure. So I think there are two key messages that it would be really important for everyone to think about and take home from today. One key message is that gender inequality and universal health coverage are tightly wound objectives. And of course, I mean this in the sense that, they're the objectives we're all striving for through the SDGs, but I also mean this in the empirical sense. So this means that when we look in this report at the data, we see that these two objectives are trending together. So they're things that are going hand in hand. So a key message is that it's absolutely critical that health and gender are working together, because you can't achieve one objective without the other. They are absolutely linked. So that's one key message. The second key message that we need to think about is that there are many forms of work that underpin our health and well-being. And I think traditionally, we've done a very good job of thinking about the employment and thinking about the formal versus informal employment and how we shift the agenda. But we haven't done as good of a job in the health and care sector of thinking about the unpaid health and care work that underpins a lot of the support, particularly across the world in certain countries. And what's key to know about that is it's important for ministries of health to think about, because there's a substitutability and a complementarity between paid and unpaid work. So those are two things that I think if we walk away thinking about that, all the better for doing the report.
I think it's excellent. And just to add to that, what I'd say is that the gender value gaps, let's think of them as a system. It's really great to focus on specific gaps like the pay gap, but actually this is an interlinked system that we have to deal with in a systems-based manner. So the care gap that we're seeing based on gender values feeds into the participation gap, the earnings gap, the data gap, the working conditions gap, and overall the investment gap in the system. So it's a systems-wide problem that needs a systems-wide approach.
And the gender equality gap at large that's being discussed this whole week. Health, absolutely, but it gets into all other areas of society as well. So it's a great report, but why is it important? When will you start?
Well, we wrote this report. It's been the result of a few years of work, and it was catalysed by the COVID pandemic. And the report comes at a time when we've got increasing socioeconomic inequality, we've got conflict going on across the world, we've got the effects of climate change being felt really, really acutely, and so many crises are overlapping that COVID uncovered. And health and care work really sits at the centre of these, and I think is the key to unlocking a much brighter, stronger future for us. So the report came at that time. What it did is that it showed that in this area of this time of multi-crises, we actually have to prioritise key aspects of gender, equity and care. And it's not just a nice to have, it is essential. What we're doing is that we are cutting ourselves short because we are focusing on the short-term objectives, not properly investing in the health and care work from a gender equity perspective, and that has ramifications. So if we can flip that switch, then we unlock cascading benefits that can actually tackle these polycrises that we're facing.
And you use the word undervalued a lot. Just put a comment on that, but also when do we know that both women and their work in health is valued?
Yeah, value is a really interesting concept. It's more than a dollar value, but the dollar value is essential. Value reflects the way that we as a culture imbue importance in a particular aspect of work. And then that has ramifications for how we pay people, how we provide quality working conditions, and how we recognise work that occurs beyond the formal sector itself. And so gender influences all of that. The way that we systematically devalue the work that often women do, caregiving labour, for example, has this flow-on effect into the way that we actually value women's work and beyond in the health sector. What that means tangibly in the health sector is that we have an artificially lower sectoral footprint, because not only are we paying women less relative to men in the sector, 24% pay gap, but at the same time the whole sector as a whole has a lower wage bill and attracts less as a feminised sector. So we've got a massive issue when it comes to valuation in terms of pay, but it's influenced by a wider culture. Furthermore, what we're doing is we're actually not seeing the value that this type of care work unlocks, which is in the tune of trillions of dollars to society and beyond. And so taking that wider perspective, which is what this report does in an evidence-based way, starts to lay out the case for investing in gender equitable health workforce and beyond.
Thanks.
Yeah, and I think just to pick up on the value, I mean, we've done a lot of technical work with the ILO looking at equal pay, but the objective is really equal pay for work of equal value. And the story that we're seeing when we're looking, through at the gender pay gaps is that the way we are valuing certain kinds of work is intricately linked to gender stereotypes and norms. And this needs to be addressed if we're actually ever going to get even close to valuing work.
The biases, yeah. So you look at so much data. I must say, kind of as an advocate, it's really data rich, but it's also translated in a tangible way so we can use it, which is not always we see that, but congrats on that. But you looked at so much data. which finding surprised you the most? Would you start?
Do you want me to start?
Yeah.
So we did 20 different analyses. So it's descriptive analyses, and we looked at 20 different angles. And every single one of the analysis supports the hypothesis that gender gaps, health, and the economy are all linked and trending together. And so to me, it's not one single finding, but it's the cumulative effect of all of the evidence that we're seeing laid out bare. And to me, that, seeing this all together, page after page after page, the same story supported, it really becomes something you can't refute.
Yeah. Totally.
One of the strongest findings for me was the relationship between universal health coverage and gender equality at a national level. What we're seeing is that countries that have stronger health systems represented by UHC measures also have stronger gender equality, and that goes so they're closely linked. It goes hand in hand. And what we were able to find in the report with data is some keys as to why that might be. For example, if we have a strong health workforce that can redistribute equitably unpaid care so that women are not unfairly burdened with that. And so that is really critical. That can unlock a range of widespread societal benefits and enable women's economic empowerment.
And the relationship is so strong that when we saw this, we actually reanalyzed it to make sure that was actually accurate, because it's so strong, that relationship.
Okay, then I have another question on that. What annoyed you the most?
Good. I was just about to say the other surprising thing. I mean, it's 2024, it was 2022 when we started writing this, and the fact that we are where we are and we still don't have the data that we need, we're starting to see it. We're starting to see the gaps that are evidenced are a result of the gaps that we still don't have evidence for. And so we need good data. And what that means, it's not just looking at doctors and nurses, it's looking at the entire health workforce. It's looking at care beyond employment in the community and as it occurs outside the formal sector. We need data that is disaggregated by sex or gender, and then we need data to go beyond that. We need it to go into intersectional dimensions so that we can really draw attention to those who are most and least advantaged by the system.
And Fast and Furious, fabulous. What annoyed you the most?
I think it was, I don't know if it's annoying, but I think one of the important things is to delineate between the different kinds of work. So I think what we're seeing is there's a lot of literature that's melding up all of the forms of work together, and I think we had to do a little bit of work to understand what are the different forms of work. And this is really important because the policy levers that are attached to each of the forms of work is slightly different. The data and how it's collected is different, right? We can use administrative data, for example, for formal sector jobs. We can use labor force surveys to understand, in many countries, some of the informal sector work, but we can't understand unpaid care work using those forms of surveys. So and how much further we need to go to really understand the concept of work and not just head counts, but actually understand the quantity, how it's distributed, and the relationship between strong health systems and that.
Okay, you have a magic wand. What do you want to happen from now? The report is there, the data is there, the analysis are there, it's solid, it's good. What do you want to see happen? And not the 25 things, but the 2 things.
Anything. I mean, there's 31 policy levers in the report, and we're not seeing action. So,
okay,
I mean, you pick any one of those 31, and you take action, and I'm happy.
Great.
I think with these actions as well, none of them target one single sector or one single issue. They're all multi-solving policies. And what that means is if you strengthen social infrastructure, then you have ripple effects on gender and gender equality, which unlocks economic empowerment. So it's good for health, it's good for women's empowerment, it's good for gender equality, and it's good for the economy. So each of these policies can be thought about that, and can be thought of in that way. And so that unlocks a range of different actions that are tangible at the national level that go beyond just a sector.
Great. Michelle and Jordan, thanks a lot for kicking us off.
Thank you so much.
And now it is my great pleasure to invite up to the podium or to the chairs Her Excellency Cindy Tatiana Quesada Hernandez, Minister of the Status of Women, Costa Rica. And Cindy, you'll be sitting next to me. And then, Cynthia Samuel Olong-Yuwon, Special Representative to the UN and Director for the ILO Office to the United Nations, and also former Regional Director for ILO to Africa. We'll get into that. And Alia El Yassir, Regional Director for UN Women Asia and the Pacific, and UN Women Representative to the Kingdom of Thailand. And then Grace Fatima Sos Rosa, General Coordinator for Comprehensive Care, the Ministry of Health, Brazil. Thanks a lot for joining me. What about a round of applause here? So we'll start with you, Minister. And I hope it's okay that we're on first name, Cindy.
Please do so.
Good.
I'm afraid that I cannot speak fluently in English, but I'll try to read so I can keep up in the timing that you
That's
just
good.
said.
Else I'll just lean
furious.
in.
Yes. Kind of scary, but it's
When
okay.
you see me leaning in. So, what were the drivers that made Costa Rica invest in the formal care system, particularly on long-term care? And also, what type of, because you have invested a lot, what type of investment were made, and how did you make the investment sustainable so it could go on?
Okay, the three at the same time, okay?
Yes.
That's correct. Okay, let's see. Well, Costa Rica was motivated by the commitment of gender equality, obviously, demographic realities, and principle of social justice. I think it's what all moves in this situation, recognizing the multifaceted nature of caring given and the implication for this individual well-being and social progress. We embark on a journey, really, and it was long ago, and we're trying to make them, better now. We are improving about the quality also, and the implications, adding more población meta, the population, okay, because at the beginning it was just for young kids, because it was like thinking about their health and nutrition and what they need in order to grow up, besides the poverty where they are. Now we're thinking with a gender agenda, which means that it's important for us that women stay at work. Meanwhile, the kids are good in good care. So that transition is very important for us. So how can we do it? Well, definitely was with financial commitments, since the executive decisions, legislative reforms, because we need the budget. Definitely have to be like, besides the political decisions in each government, and they collaborate with partnership. And that is something that we are exploring this moment, because we're trying about the co-payment with the private sector, and we trying with them because they know there is a good investment, because they have to, try to make the recruiting. Again, every time that a woman has to leave work, because they have to attend the caring, because it's most of the women, and the learning curve, all those is money for the companies, and we prove them that it's better for them to invest in a co-payment program of childcare or elder care than start, try again the system to hire a new person. And then the last one was about...
Well, it was about the sustainability, but you mentioned that.
Yes,
because it's about, I think it's so good that you got the corporates with it.
Yeah, we're trying.
Really shows the benefits for everybody.
Yes, Costa Rica is, in this moment, we have a great income with business out of Costa Rica to came here to invest in Costa Rica. So we are putting out not only the sustainability about the environmental, but also about the gender agenda.
Yeah.
So for us and for many of these companies, it's a good deal to bring part of that strategy. But also in Costa Rica, the most of the business are small or medium, so we try to first with seals and good practices seals that give them benefits if they do in that direction help us to the co-payment. So we try to be, I don't know, kind of creative to see how can we make the cultural change, first of all.
And Cynthia, you had support for this all the way to the top, didn't you?
That's correct. That's the only way. Yes, that's the only way.
That's good. Thank you. Thank
You're
you very much.
welcome.
I'll get back to you a little later. Cynthia, your turn. Before leading the ILO office here in New York, you were the regional director, as I said, for ILO for Afro. Can you just briefly, in some broad strokes, reflect on that context, and where do the care work policies stand on the continent?
Thank you very much. And I'll make sure that I speak within the time that you don't have to lean towards me. But really, to thank WHO for inviting us for this meeting, which we see as a very good continuation of the conversation we had last year in Geneva during the health workforce. And indeed, I used to be the regional director, but I don't think Africa has really come out of me. I still wear the African hat, even though I'm in a global situation. 3 very important points. And let me say thanks to Michelle and, sorry, I forgot the name, for the earlier interventions. They set the stage very well for whatever I'm going to say within the context of Africa, but even beyond, in terms of the gaps, but also in terms of the interconnections. And indeed, it's quite frustrating that a lot of the things we talked about last year are still very relevant. Specifically for Africa, 3 things. One, it's not a homogeneous situation. There are variations. You know, we look at issues, whether conflict settings, non-conflict settings, these are important. The issues in terms of even the socioeconomic policy environment. You talked, Madam Minister, about the fact that Costa Rica anchored its interventions on the platform of social justice. That is very, very important. The situation in the continent, quite different. And when we look at the report itself, in terms of unpaid, paid care work, in terms of the health and long-term care, in terms of domestic work, the issues around recognition, the issues around remuneration, but also the issues around support. It's a very varied landscape. So that's the first one. The second one, and it also links with the first one, is the high level of informality. But this is also not the same. You know, in some of the countries, you have informality levels at close to 90%. In others, it's about 50%. But informality, whether in terms of access to employment, but also in terms of care, is an important dimension when we look at the landscape in Africa. And one of the things that we have found from the ILO and from the collaboration we've had with organizations like WHO is that addressing social security is very, very important in terms of being able to provide the kind of quality of care that is required in the continent. And when we look at the statistics, it's telling. For the aggregate figures for Africa in terms of access to social health security is 23.7%. Social health protection is 23.7%, which is low. But when you unpack this in the different subregions, it's almost 60% in North Africa. And then when you look at sub-Saharan Africa, it's 15%. Huge difference with implications for access, for care, and for all the other issues that we talked about. And more so, we found that it also relates to the gap that was made. Very significant underinvestment in finance. The third part that I will put on the table is in terms of social protection. So it goes beyond the social health protection, social protection. In Africa, social protection is less than 18%. And we know that there's a strong correlation between social protection coverage and the gender dimensions of the issues. Last positive point two things positive that I'll put on the table. There is a strategy for doubling social protection coverage in Africa, bringing together different institutions. So that's something that is on the table, looking at informality, looking at financing, looking at the data gaps and all the other gaps that have been talked about. The other positive thing is that we have very interesting experiences in Africa on countries that have significantly moved the needle, and to see how those can be effective inspiration, as it were, for other countries in the region.
I'm just going to stick another question in, if I may. So if we look at the public health institutions, how do we strengthen them to bridge that care gap? You touched upon it, but also why is it important from a labor perspective? Some years ago, everybody spoke about the community health workers as that was what's going to save the world, and we know that it might save a lot of lives, but it's definitely not necessarily good for the women who mostly hold these positions.
That's very, very crucial, especially within the context of the focus of CSW68, which is looking at economic empowerment of women, but also alleviating poverty. And when we talk about systems earlier, it's not just the interconnections between the gaps, but also the interconnection between the different SDGs. So investing in one has a spin-off on others. I'll highlight three things here in terms of your question. The first one, it's really important to understand that health and care sector constitutes significant source of employment within the broader care economy. But it's so invested, undervalued, and so underexploited, if I can use the word. We're not fully harnessing that opportunity. If the ILO estimate shows that meeting the SDT targets on health create 173 million jobs in health and social work. Additional jobs are generated in other sectors through backward linkages. When we now invest in long-term care services, the opportunity is to create about 50 million additional jobs. So there's that, investing strategically and investing directly and deliberately. And that's where the issue of the policy choice, like social justice that Costa Rica made. The second one is we really need to challenge I'll stop with this. Really challenge the traditional views of health and care systems as economic burdens. They are not economic burdens. They are actually opportunities not only to create wealth, but also to enhance well-being, which has implications for wealth at all levels. Absolutely. So I'll stop there.
Absolutely. Thank you. And over to you, Alia. Alia, you work in the Asia-Pacific region as the regional director for UN Women. Where do we stand, or where do you stand in the region with regards to unpaid care work, particularly in health, and where do you see the gaps?
Okay, Asia-Pacific region accounts for 60% of the world's population, so it's absolutely massive. So again, take this with a pinch of salt, when we're talking about averages. But women in the Asia and Pacific region spend an average of 7.7 hours per day on care and domestic work. 60% of that is unpaid. This is above the global average. And during COVID, when the care and domestic work burden increased within households, 88% was borne by women and girls across the region. There are some interesting facts about the region in terms of, I think it will not surprise you, that the region accounts for the majority of migrant domestic and care workers. It is also the largest employer of domestic and care workers and has the largest shortage of care workers in the world. What this means is that there is a decent work deficit, and demand for this kind of work is likely to increase because of demographic shifts. We are in ICPD plus 30 this year. Demographic trends are top of mind for many member states, and gender equality is at the heart of this, but also this burden of care is top of mind, and how to deal with care responsibilities from the state perspective so that women are encouraged to have children and balance that. And also, I think something that hasn't been touched on is climate. Climate change is a big issue in the Asia-Pacific region, and the nexus between care and climate is something that really requires a lot of attention and some in-depth thinking about.
And what do you, so that was really good. So what's most needed in the region to better the valuation of health and care work?
Okay, I'm going to touch on some things that we're seeing, what is most needed, but what we're seeing promising.
Okay, yes.
Promising practices, or, I want to reiterate, and I put it as number one, which is the work on data. There is an expression I heard that really I carry with me wherever I go, which is that we treasure what we measure. If we're not measuring something, we're not valuing it. This is the only way that we can make whatever is currently invisible, visible. Doesn't mean it's not there, it's just that we're not seeing it. So if we want to have policies, we have to do this work. And there was a talk about, how do you look at care through data? But time use surveys are critical. And so what we see in the region, for example, a country like Bangladesh, since they have done a time use survey, they have been able to look at time poverty. So when we're thinking about poverty, not only in terms of income poverty, and therefore this is informing their thinking in terms of the care policies that they would like to put in place. I also want to highlight, for example, in Nepal, what they are doing, and it's very much needed, which is a whole of government approach. So they want to develop a care law. They're not doing it through a single ministry. They're doing it as a whole of government effort. And the final point, there are many others, but I do want to talk about, in the theme of this year's CSW, financing, because without money and resources, none of these plans or policies will ever take place. So in a place like Philippines, where they are really leveraging gender-responsive budgeting for financing of what they're calling child-minding centers in all government agencies and also any government-controlled corporations. This goes a long way to supporting these care policies and moving beyond lip service and moving into action.
Thanks a lot. Thanks, Alga. And Grace? Will you be translating from, yes, so now we're going to Brazil, wonderful country in general, and with some big global events coming up, both a G20, but also a big COP next year. Yes, sure. Yeah, there's a big event coming up, so the light is shining on Brazil with G20 and COP and the things coming up the next. And congratulations on President Lula's legislation on equal pay. That was. And closely related to that is the. is the care policy work that you oversee in your role. Yeah, exactly. Okay, yes. So what are one or two things that you can draw out from this and share with us that can inspire all of us that you're working on right now?
Quais seriam, assim, uma ou duas coisas que você pode retirar disso que ela acabou de falar, da igualdade salarial e da política de cuidados, e inspirar-nos, inspirar a gente?
Boa tarde, boa noite.
Good afternoon, good evening.
Primeiro é importante dizer que tanto a lei de igualdade salarial quanto a política de cuidados e outras estratégias que o governo do presidente Lula vem trazendo compõem um conjunto de ações para o enfrentamento à pobreza, o enfrentamento da fome.
Okay, first of all, it's important to state that this policy about the equal pay between men and women and the policy about care work, it's part of a bigger package, which is the package to combat poverty and hunger in Brazil.
E o combate à fome e à pobreza no Brasil está diretamente ligado ao enfrentamento das desigualdades de gênero.
And to combat hunger and poverty in Brazil is directly linked to combat gender gaps and gender inequality also in Brazil.
E as ações de cuidado no Brasil, como em todos os lugares do mundo, estão muito concentradas nas mulheres.
Care policies in Brazil, as elsewhere in the world, it's highly concentrated in women.
E esse trabalho do cuidado não é só feminizado, como também é racializado no Brasil. As mulheres negras têm uma sobrecarga.
And in Brazil, care work, it's not only gendered, but also racialized, because black women, brown and black women in Brazil, they usually work as care workers.
Então, se eu for retirar duas coisas para destacar no processo de construção da política de cuidado e da estratégia da lei de igualdade salarial, eu destacaria, primeiro, a necessidade do país reconhecer que o cuidado é um direito universal.
So, if I should say two things, the two most important things, the first one is, sorry, qual é a primeira coisa?
O reconhecimento de que o cuidado é um direito universal.
The most important thing that I choose to say is that care is a universal right.
Todas as pessoas, em algum momento do curso de vida, precisam de cuidados.
Everyone in a given moment of their lives, they need care. They will need care.
E existe uma organização social do cuidado que é injusta, não é equânime, não é ética e moral, né, para as mulheres, sobretudo para as mulheres negras.
And there is a social organization of care that it's not fair and it's not ethical, especially for black and brown women.
Então, a política de cuidados veio mobilizando sujeitos sociais, atores governamentais de muitos setores, saúde, assistência social, educação, trabalho e emprego, para a construção de uma política compreendendo que é responsabilidade do Estado e da sociedade o cuidado com as pessoas.
So this new policy understands that the responsibility for care, a responsabilidade do cuidado é
compartilhada entre a sociedade, o Estado e as famílias, né?
Okay, so this new policy establishes that the burden and the responsibility of care should be shared between the state, the family, and everyone in the society.
Assim como as empresas precisam criar mecanismos de permitir que as mulheres possam trabalhar em igualdade de condições dos homens para que tenham os mesmos salários e possam ascender profissionalmente, assim como os homens.
It's also important that companies in Brazil, that we have mechanisms that make companies understand that women has to progress in their careers and also be in their families and also do the care work.
Thanks a lot. Thank you. So time flies when you're having fun. We're going to take a quick fire round here at the end, because we know we have amazing people in the audience, including some parliamentarians from Brazil and from other places. So it is people with great power and muscle who are here. So what if I tell you that you have 1 minute each, and I'm going to time it. And I want you to, if you have one message and one advice for the people here.
Can I translate that?
Sure.
Ela disse que vocês vão ter 1 minuto e um conselho para dizer para todo mundo. Assim, a mensagem final, em 1 minuto.
So, will you start?
Let's start. I would like to. Well, I would like to highlight 2 ideas, and I think it's very important. The first of all, and one of the panelists just say it, is that we view the access to quality care as a fundamental right. That's definitely, and that makes us go prompting to dignity, autonomy, and well-being of all women by prioritizing the establishment of child care facilities, elder care centers, and support the services for individual disabilities. And the second is that a part of the strategy, it's about the equipping the women with the skills and knowledge necessary to provide high quality care. So by professionalizing caregivers' workforces, we not only improve the quality of care, but also create employment opportunities and economy empowerment for caregivers, and predominantly are women. So I think it's a good deal, win-win for all.
And Alia, would you go next?
Okay. First of all, congratulations on a great report. And the policy, I think this is, yeah. Hopefully this is better. Yes? Okay. So congratulations on the report. To the policymakers and the decision makers, do not wait for any more evidence. What we really need is political will. That's the only thing that will change things. That's the first message. And I want to congratulate Costa Rica and Brazil, not only for the work that they're doing to get within their own countries, but also as part of the Global Alliance of Care, which now has over 170 members. And I want to congratulate the Latin American region for leading this, but there is an opportunity for others to come on board, because the how-to is going to be context specific, but there's a lot of learning that can be done. And that speaks to my second message, which is partnership and the power of partnership through multilateralism. This is the way that we can get things done. And by engaging what we've heard also with the non-traditional partners, private sector has a huge role to play. And they are waiting for us to bring them into this conversation. So this is my call to you, that only together we're going to figure out the way to do it. But there's no question about if we have to do it. I think we're way past that point now. Thank you.
Thanks a lot.
Can I just
And
quickly translate?
Yes.
Ela falou que ela congratula, parabeniza o Brasil, não só pelas políticas que ela mencionou, mas por fazer também parte dessa aliança global de cuidados, que já tem mais de 170 países, e a América Latina está liderando esse processo também.
So one message and one advice.
Uma mensagem-chave e um conselho em 1 minuto. No, more than 1 minute, because I need to translate. Sorry.
Essa discussão não pode ser só das mulheres, né?
This discussion cannot be only between women.
É preciso que a gente crie mecanismos enquanto Estado, enquanto sociedade, para produzir fissuras nos modos de subjetivação masculina.
That's hard. We need to create ways and methods to crack the masculine subjectivities.
A gente não consegue mudar os modos de produção do trabalho se a gente não produzir essas mudanças na forma como as pessoas se produzem enquanto sujeitos.
We cannot change the way we produce work, the way we work, if we cannot change ourselves as subjects.
É necessário que na construção de uma política de cuidados haja uma integração de diversos setores para que não tenham, o Estado não fique como subsidiário de políticas fragmentadas e não consiga garantir um cuidado integral. O Estado precisa investir numa política integral de cuidados e não ficar como subsidiário de ações fragmentadas nos setores.
Okay, the state needs to invest in a comprehensive care policy instead of silos that sometimes we see in public policy.
Right. Thank you. Thank you. And Cynthia, last but not least, how do we get over this undervaluation of women? What needs to happen? One message, one advice.
One message, one advice. It's really building on what the distinguished representative of Brazil said in terms of this integrated action towards addressing the problem rather than addressing the problem from silos where different stakeholders with different mandates and different competences come together in a way that 1 + 1 will give you more than probably 1,000, particularly when it comes to promoting the decency of work in the care and health sector, or health and care sector. So that's the recommendation. And then in terms of the advice, the ILO, as some of you may be aware, will be having a very important discussion, a general discussion on decent work and the care economy in June. So the call is that every stakeholder to see the extent that they can engage in this, as we did for C190, which was a convention, but this is a discussion, and see how we take the outcomes and make sure that they are implemented.
Thanks a lot. Should we give this wonderful panel a hand? Thank you, ladies. Thank you very much.
Thank you very much.
And now it's my great pleasure to invite Jim Campbell, who's the director of the Health Workforce Department at WHO, up here. Jim, one word, action. And that's exactly where our esteemed panel ended. And I saw that you were scribbling. Yes. So what did you hear?
What did I hear? Well, thank you very much to all our panelists and to our informal translator, Rafaela. Obrigado.
You did great.
Really appreciate it. Today we're joined by many, many different constituencies, parliamentarians, government agencies, bilateral civil society, unions in terms of the thing. And so the partnership element, very, very visible on that. But just a couple of points and reflections, and we've got the banner there. The report identifies 6 gender value gaps. And Jordan and Michelle have done an excellent job bringing all that analysis together in a coherent way, which we can use to communicate. 31 policy actions to get. And several people spoke about data. Not everyone has a president like Costa Rica who's an economist and understands these issues. Not everyone has someone is committed to social justice as we have in Brazil. But there's a political role, yes, but we can all take action. We don't have to have only the leadership to come further forward. Whether that's on the data, whether that's on the care gap, whether that's on the working quality gap, to come further forward. There's so much work to be done that partnership is going to make the difference to really come together in a way that can do that. Cynthia talked about ILO and the role there, the partnership we have. We were here, many and some in the audience were here 8 years ago when we had these discussions on employment in the health and care economy and the triple dividend that brings. We're still trying to get that message. We've got better data than we had 8 years ago. We've got a stronger narrative, but we're still not getting the action consistency. And that's something, Katja, that we'd invite all the partners here today and elsewhere. We're looking for, part of this action process, that we get at least 20 countries taking actions in these 6 domains, in the 31 policy areas, and try to work together, government, civil society, academia, UN family, multilateral work, as Cynthia was talking about, at the heart.
Yeah. Thanks a lot. Thanks, Jim. And I, as you will also note, when you read the report, is that the actions put forward are not wishful thinking. They are actually tested, tried, and delivered. So what about us shaking hands that we're going to take these findings and tell at least 5 other important people about them? Because this launch is not a one-off, it is merely a start, and the discussion needs, and the report and the data, and then more data that'll be coming, needs to be taken forward and into some of those world fora where some of the big powers and money powers and political powers are meeting. So do all you can to get it into the World Bank and to get it to the W20, or to get it to the G20 and the G7 and the Summit for the Future and Davos and all those places. Let's say we do that. And also at the national and local level, great examples of what is being done, and not just dreamt, but done. So we know we have problems, lots of them, but we also know what needs to be done and implemented. So thank you to the strong voices here and the good examples. I see strong people with strong platforms and big muscle, and a big encouragement to take it home. Let's go do it. Thank you.